So hello to everybody who is joining us. Abby, are you letting people in from the waiting room?
Yes.
So hello to everyone who is joining us. We appreciate you joining us tonight on a Thursday evening. This week is going to be Infertility Awareness Shabbat, and we are so happy to join with Sinai Temple to create an incredible webinar for really supporting our community as a whole, navigating building families in different kind of ways. I am Natalie Richheimer. I am a genetic counselor. We have Dr. Sahar Wertheimer with us, who is a reproductive endocrinologist, a fertility doctor. We have Dr. Justin Human with us, who is a reproductive urologist. And we have Gila Block, who is the founder of Yesh Chikva and a fertility mental health advocate. Tonight, we will be doing a panel discussion. We will go through questions that we think come up a lot of the time when people are building families. And then we'll take questions and answers at the end. Starting off with Dr. Wertheimer. We are going to talk a little bit about fertility treatments and assisted reproductive technology. Can you tell us, Dr. Wertheimer, a little bit what are the different treatment options for fertility available today?
There are a range of options for fertility treatment. And typically we define infertility as somebody who has been trying without protection for a year. If they're under 35, if they're over 35, it could be 6 months or less if they are over 40. And at that point, even if the entire evaluation comes up negative or unexplained, we still recommend treatment. And so there's lower technology treatment like ovulation induction with an intrauterine insemination, where we essentially trick the brain instead of developing one follicle a month to develop 2 or 3 follicles a month. And then in each follicle houses one microscopic egg. And then once those follicles are what we call mature or ready to be fertilized, we trigger and we're essentially mimicking the patient's ovulation hormone. And then we time intercourse, or we do an intrauterine insemination at the correct window to maximize chances of fertilization of that egg and to maximize the amount of normal eggs that might be available that month. Um, That's typically done for women who are having trouble with regular ovulation, like women with PCOS, or men who have some sort of male factor infertility, which Dr. Human will talk more about, to try to essentially concentrate the sperm and put the front runners closer to where they need to go. And then we have IVF, which is our a higher technology modality where I like to describe IVF as 3 parts. Part 1, we take the eggs out of the female. Part 2, we fertilize them, grow them to embryos in the lab. That's the in vitro part. And then part 3, we transfer the embryos back to the uterus when you're ready to get pregnant. And that could be the next month, or it can be months later. 1 second. Um, and so in IVF, the idea is that we want to increase efficiency of the reproductive system by getting all the eggs that's possible to get that month from the ovaries and find that normal egg, get the best, whittle it down, fertilization, making it to the embryo stage. And once we get a normal chromosomal embryo, we know we have about a 70% chance of pregnancy, which sounds low, but in actuality is quite good. I always tell patients, prime fertility is probably a 25% pregnancy rate every month, which just goes to show that reproduction at best is highly inefficient. And so in IVF, we're essentially trying to increase efficiency.
Wow, those numbers are really, really great to hear and kind of really put color to what you're saying.
Yes.
I think a lot of the times people have questions who are in same-sex relationships, and people who are single individuals seeking to have children without a partner.
You are.
How do you, as a reproductive endocrinologist, approach fertility treatment for same-sex couples or people who are single by choice and hoping to have a parent, become a parent, a single parent on their own?
So single by choice, and or we call it single moms by choice, or women in a same-sex female relationship have some overlap in the treatment that's available to them. If you want to get pregnant right away, we can get you pregnant with donor sperm. And that could be paired with ovulation induction, like I had previously described, or with just a natural cycle, depending on, age and other fertility factors. There's also an option to do IVF, where either we're doing it to preserve fertility for future pregnancies, or because she's not ready to get pregnant right now, but wants to make embryos, or in a same-sex female couple. A lot of times the reason to do IVF is because they're interested in something called reciprocal IVF, where we can take the eggs from each female partner and fertilize them with donor sperm, and then actually transfer them back into the other uterus. So each partner feels like they've had a role in each pregnancy, whether it's the uterus or the genetic material of the egg. In same-sex male couples, the options, it's pretty much one option, and that is third-party reproduction, where we get a donor egg, a donor who gives us eggs, fertilize it with the sperm, and then use a gestational carrier to carry that pregnancy to term.
And, you talked a lot about success rates for IVF. What about the success rate for something like an IUI? What does that look like compared to an IVF success rate?
IUI, we quote on the better side between 10 to 15% success rate, but it is very influenced by female age, as is IVF, but also what the underlying cause of infertility is. And so 10 to 15% is usually my more optimistic statistic that I will quote. And I do think, and I would love to do a study on this, but I think the amount of years that you have been trying to conceive without pregnancy dictates the success of IUI. So, for example, patients that have been trying for, like, let's say 6 years without success, I'm quite doubtful that IUI is really going to help them, even the 10 to 15% success. But if it's been somebody who's been trying maybe more like a year, then I'm a little bit more hopeful about IVF helping them, IUI helping them.
And I think it's so helpful to hear those numbers because the percentages, like you're saying, are very, very different. So some people
Yes.
will say, like, why do people go straight to IVF? And I think it's helpful to hear those numbers really, really putting everything into perspective. Um,
Yeah, I think that a lot of times people hear these numbers and they actually get a little bit scared because they're hoping to hear something like 100%. But unfortunately, we're not there in science, maybe one day. But I like to just remind people that the bar that we should be comparing ourselves to is the bar of that fertile couple, their monthly pregnancy rate being about, 25%. So while an IUI might only be 10 to 15%, it's not zero. So it is something substantial compared to the fertile couple, that, our example of the bar. And while a transfer, we say with a euploid embryo is about 70%, that actually shows you how good it is. It's almost triple, a young couple's fertility rates. So
yeah. And I
just
guess
to
that
put it
kind
in
of
perspective.
really extends to my last question for you is, and this is hard always, how do you manage patient expectations? I think everyone wants to come to you and come home with tons of embryos and the beautiful baby that they've been waiting for. But like you're saying, 70% isn't 100%. How would you manage patient expectations? And what would you say to anyone who's listening, who's thinking about going down this path?
I think it's a great question because I think patient expectations, and I'm sure Dr. Human will agree, is like the name of the game. I think that you will end up with a very dissatisfied patient if you don't take the time to counsel appropriately. But if me and my patient are on the same page, then I feel like we're able to be better partners and shared decision makers. And what I tell my patients is, I don't want to steal your money. I'm not here to give you false statistics and then you're upset and you didn't get what you want. I'm here to give you the statistics that science shows, what my personal recommendation is. And then if you don't want to do that and you still want to, let's say it's somebody with who I don't have high hopes for getting a euploid embryo. I'm still here to support you. If you still want to try, I will still try with you because I'm not God and I have the humility to know that I'm not always, right, and science is not always right and there are the people that beat the statistics. But my main concern is really the dissatisfaction that comes if I overpromise. I'd rather underpromise and overdeliver. So I think managing patient expectations, and I think most people are reasonable and they want the same thing you want, which is a successful pregnancy. And so if you take the time to really walk them through the science and the statistics and the studies, I find that most patients are on the same page as me by the end of a consult.
And I love what you're saying of like, you're not there to take people's money. You want the same thing as the patient at the end of the day. The goal is for everyone to have a beautiful, beautiful, healthy baby. So your
That is
patients are so
gratitude.
lucky to
Yeah.
have you. I'm
Thank
gonna switch
you.
gears a little bit to Dr. Human, who's our reproductive and urologist, and talk a little bit about male infertility because I think a lot of the times it's not something that we talk about. And I'm so happy that you're here to really put a spotlight on that. Um, just for those who are maybe curious, how do you assess for male fertility and what are common issues that contribute to male infertility?
Great question. So, as much as infertility is the burden a lot of times falls on the female partner, the male in many ways is contributing to it as well. And there's a number of reasons. Although men are ejaculating tens of millions of sperm each time, or at least a healthy male is, there's reasons why either the sperm counts are low, the way they look, the DNA, what have you. They're not good enough in order to achieve reproductive success. So, to answer your question, when it comes to how do you assess male fertility, it comes down to three things. It's a blood test that we do that checks for their hormone levels. We want to make sure everything's okay from a hormonal standpoint. But more importantly, what we do is a semen analysis. A semen analysis is the first test we do to see whether or not a man or where his baseline sperm counts are, how the sperm look, what the volume of the sperm is. All of this gives us a good sense of what that male, his reproductive chances are. So we do that, we do a blood test, and then lastly, we do a physical exam just to make sure everything is okay. Sometimes guys are missing one of the tubes that carries sperm from the testicles to the outside world. Sometimes they have varicoceles or dilated veins of the scrotum. All of these things can contribute to infertility, but it's a relatively simple workup.
And someone comes to you, you've assessed that they have infertility. I think people get nervous is like there's nothing to do. Like I can't help them. My question is, and we know that's not true. What are some treatment options that are available for men with infertility? And I love how you broke it down to different causes because obviously we're going to treat differently based on those causes. But can you tell us in general, like what do treatment options look like?
So there's four main reasons why a male has infertility or is experiencing infertility. Number one, abnormal hormones, like we talked about. So if a guy has low testosterone, maybe his estrogen levels are off, just abnormal hormone profile, by boosting up his testosterone levels, at least in a natural way. Not we're not talking about testosterone replacement therapy, but if we're telling his testicles to produce more testosterone, that will lead to healthier sperm. So all sperm need healthy intratesticular testosterone. So that's the first thing. Secondly, um, sometimes there's genetics involved. So at this point, there's probably hundreds of genes that control male fertility. In 2025, modern medicine, we only could test for four. So we do a blood test to test for those four genes. If there is anything abnormal in those four genes, we'll have some sense of what's going on. From a genetic standpoint, let's say this is where it kind of gets a little dicey in terms of the treatment options. Typically speaking, if you have a genetic issue in terms of producing sperm, we'd have to do something. It's a we do a microsurgery to go in the testicle to remove and find individual sperm. So that's the treatment if you have a genetic issue. The third reason why we have infertility is varicose veins, or we call them varicoceles, which are the dilated veins of the testicles. Those increase testicular temperature, damage the testicle, damage the sperm. The treatment for that, again, is something similar to that. It's a microsurgical surgery where we go in there, we tie off the individual veins, and ensure that there's no blood pooling around the testicle, which improves sperm counts. And then lastly, it's lifestyle. So things like saunas, steam rooms, jacuzzis, cell phones on the front pocket, laptops on lap, all of these things that can negatively impact your testicular health. Those types of things, we tell guys to avoid those, and that in itself is a treatment for lifestyle associated infertility issues.
And I love that you mentioned, sorry, go ahead, Sahar.
I was gonna ask Dr. Human what he thinks about this new trend with the saunas every day.
Yeah, so it's not bad. If the caveat to that is if you're icing your testicles or you're protecting your testicles from the heat. That's the so a lot of guys are doing that. I mean, I don't know if I went to a hotel recently and I was in the sauna, the dry sauna, and there was a guy who literally had an ice pack on his scrotum because he was
Wow, I didn't
protecting
know
his
that.
sperm. Yeah, so that
Wow.
protects it. That does a good job. If you could fully engage in those things, it's not a problem. Cold plunge, absolutely. There's no harm in cold plunge. It's the
Yeah.
heat that really damages the sperm. Cold doesn't do anything.
It's really good to know. And again, like there are options, like you said, if you want to in indulge in some, interesting health practices. My other question for you, and I know this comes up a lot, and you are very into lifestyle, and I love that because I feel like sometimes there is control in the way we live our lives. What are your thoughts about exercise and diet as well to helping improve sperm quality?
For sure. Like anything that's good for your heart is going to be good for your reproductive health. So it's pretty easy and it's simple in that sense. But it's even easier if you think about it like this. Like if you're trying to become a father, whether it's a first-time father or a third-time father, what have you, it requires a certain amount of energy and physical stamina, if you will. So the healthier you are going into the fertility journey, the better off your outcomes are. Like the healthier you are as you're trying to become a father, the healthier you will be when you become a father. So if you're exercising, mix of cardio and strength training, obviously, diet, and you don't have to be super regimented with your diet, but you want a well-balanced diet, complex carbohydrates, lean proteins, good fats. Sleep is a big one. Try to get at least 7 hours of sleep. That's huge. And then stress. Those are the four things I'd tell any guy from a lifestyle standpoint. Those are good for longevity. Those are good for your cardiac health. Those are good for fertility health. Those are good for hormonal health. It's no, to live a long time. It's not. I don't want to say it's not rocket science, but we could all live long, healthy lives if we find ways of doing those four things more often than not. And it's very hard. I'm not here to tell you I could do it better than anybody else because I have a challenge. I have a hard time doing it. But like anything else, you just try to simplify it and do those four things.
Yeah, and I love that. And like you're saying, we can all take steps, right? If it's you can't do 5 days at the gym, try one day, right? We can all do this incrementally and improve our health. I'm a genetic counselor, and I'm going to talk a little bit about the genetic piece um quickly, and I want to then get into the mental health piece, which is of course so important. Um, but as a genetic counselor, I was a reproductive genetic counselor before I joined the nonprofit space. And a lot of the patients I would see were people who were doing preconception, whether that was for a first child or a subsequent child. And people will ask me, like, when is the right time to engage in genetic testing and engage in genetic counseling? And for me, that is prior to a pregnancy. I'm a big believer in prior to a pregnancy, you have more options. I think, talking about IVF specifically, there's this incredible technology which Dr. Wertheimer has access to called PGT or pre-implantation genetic testing. And if we know that before someone achieves a pregnancy or before someone creates embryos, um, it's better. It gives us more options. It allows us to, screen embryos for genetic disorders, recessive disorders, things we test for at J-screen that can be more common in the Jewish community. Things like Tay-Sachs, which people are very aware of in the Ashkenazi community, HIBM in the Persian community, the list goes on and on. So doing that testing prior to achieving a pregnancy or creating embryos is very helpful. Um, and the genetic conditions we're looking for can impact fertility, like Dr. Human said. There's people who are cystic fibrosis carriers as males, and that will tell us that there is an increased chance in certain cases for male infertility, and we'd want them to see someone like Dr. Human, so that can really help put them on the path to a great care. There are things like Fragile X, being a carrier for Fragile X, which can put someone at an increased risk for premature ovarian failure. There are things that are risks for things like BRCA1 and 2, which are associated with, hereditary cancer risks, but are also associated sometimes with recessive risks for things like Fanconi's anemia, and also may put someone with ovaries on a different timeline, right? They may want to produce embryos or eggs earlier because they may want to remove their ovaries to prevent them from getting cancer. So having those genetic tests done earlier is always better, in my opinion. It gives you more options. Um, when people ask me, what are the risks versus the benefits of using genetic screening? I will say, to me, the benefits we've just discussed, it's giving you more options. It's allowing you to hopefully build your family in a healthy fashion and to help you really take care of your health. So like Dr. Human was saying, if you're becoming a mom or a dad, we want you in the best shape possible. So I think that's really important. The risks, I always say, it's not a painful test, but sometimes it can reveal things that are surprises and can be really emotionally taxing, things that we didn't think about before and can have implications for us or our children that we didn't think about our family members. And so I think that's a really great segue into talking about the mental health aspect, which sometimes really gets lost for patients or couples who are going through the fertility space. And we have with us Gila Block, who is the founder of an incredible organization called Yesh Tikva that provides mental health support to those who are going through the fertility space. And my first question to you, Gila, is going to be, we know that fertility treatment can be taxing, but it also can be emotionally challenging. What mental health challenges do individuals or couples who are going through this journey, what do they face that's more unique?
So thank you firstly for hosting this incredible panel. I've learned so much already just from listening to Dr. Wertheimer and Dr. Human. And I've been in this space for a while, and it's just so enlightening each time to be able to learn, and from you as well, Natalie. I think that there are multiple mental health challenges that individuals in the fertility space face. When one struggles to have something that so naturally comes to others, there is definitely emotional experiences of depression, anxiety, feeling of loss, and the inability to fit in to community. So a lot of deep loneliness is experienced by individuals facing a fertility journey. And I'm happy to go deeper than that if you would like.
No, but I think that is really important because, Sinai Temple is an incredible temple, but a lot of that programming and a lot of, community spaces are really built around families. And so you do have this feeling of loneliness. I myself, I will tout everyone in this group. I myself have gone through infertility and have had my babies through IVF. Um, and having a resource, to feel included in the community was so important to me. So I'm so happy we have someone like Gila here to shine light to that. Um, Continuing on, what are some coping strategies or support resources that you would recommend for people who are going through IVF or just fertility treatments in general?
For sure, there are lots of incredible coping strategies. I think the most important thing that one should do is find a mental health professional or a trusted support system that will enable them to carry them through this space. It is, as the last question showed, there are a lot of mental health challenges that one faces, and though the ultimate space that you're going to be held is by your doctors, having that support of a mental health professional can help you through the many emotional hurdles that come up along the journey, whether it is, as you asked Dr. Wertheimer in the last question, about expectations and setting expectations, but also a big piece of the journey is, what is your ultimate goal? And that is a piece that really opens and closes so many doors throughout a journey. So if your ultimate goal is to have a child by any means possible, there's a lot of mourning that happens as you close one door to open the next. And if your goal is to be genetically related to a child that you carry, then there are doors that will never be opened to you on that journey. And so having a support system of a mental health professional who is specifically trained in reproductive health as a perimental health counselor is someone who can hold you and guide you through that space. So firstly, that is, I think, one of the most important pieces. And to add a caveat to that is, even when you're holding, God willing, that miracle in your arms, that doesn't mean you've healed. That means you've closed the door to this chapter of your journey, and the healing now can begin. So also having that support through that. And then on a more self-care space, having friends that you can lean on, having support groups that you can attend, resources like Yesh Tikva's Fertility Friend Mentors. It's a wonderful place to connect with others who have gone through the journey and are here to be active listeners for you. As well as yoga, mindfulness, meditation, self-care, setting boundaries. There's just so many things that we can do for ourselves to hold ourselves, and most importantly, giving yourself grace, because it is really, really difficult to be in pain, and life goes on around you, and triggers can come up at any moment. And if you prepare yourself with grace to hold yourself through those moments, it definitely makes all the difference.
Yeah, and I want to speak to kind of two things that you were talking about. You know, the beautiful thing about going to someone like Dr. Wertheimer or Dr. Human is this is their space. They get it. You have questions. You're never going to be a weird person asking the questions. But when we go out often into our own personal spaces, I can talk from my own journey. No one in my family had ever gone through fertility treatment, ever. None of my friends had. And so it was kind of like, we don't know how to support you. We love you. We don't get it. We're going to ask inappropriate questions because people just do. And so finding Yesh Tikva, finding a space for me to have people who just like who got it, who were like not my doctor, but were like a regular person who I could talk about injections with. It really made a huge difference in my journey, and it really normalized it for me and made me feel like, okay, there are other people going through this. It's not just us. And so I'm incredibly grateful for the work everyone does on this panel. I benefited tremendously from professionals like all of you. So I have tremendous gratitude. I would say my next question is going to be, and this is
Natalie, before we jump to the next question, I would even add one more piece to the piece that you were saying. I think that the more we speak about it, not only do you have people that you can lean on, you now create awareness and education in those people who have never experienced it. So a family member who may have never experienced infertility now has a way to educate themselves. The more information about infertility is out there in the world, the more anyone can become. They may not be able to relate to what it means to wake up at 5 o'clock in the morning to sit outside your doctor's office. So you're the first patient in at 6 o'clock, so you can make it to work without anyone knowing. But they will be able to understand, oh, a cycle of IVF includes morning monitoring experiences like that. And though I may not have experienced it personally, I understand that that's a part of your experience. So I can hold space for that experience of yours.
I want to just bring this to the panel because I think it's huge. And again, I'm using myself as an example. HIPAA compliant. I always say I'm always the patient that I talk about. But I just feel like in my totally anecdotal bubble, I feel like the prevalence of IVF, the conversation around fertility has really come to a different place in the past 10 years. When I went on my journey 10, 11 years ago, I didn't know anyone who did IVF. And now I feel like I hear about it all the time. I see Chrissy Teigen post some pictures. Do you feel like people are more open? People are getting the help they need, even with male fertility, Dr. Human? I don't think I heard about that like 10, 11 years ago. And now like, oh yeah, like I see people on Instagram who are influencers posting like, yeah, I'm gonna go get my partner's sperm checked. Do you feel like that's come into more of the popular vernacular? And do you think people have more of an awareness, in the past 5, 10 years?
Yeah, I mean, I think the taboos associated with all of these infertility and as a whole, I mean, I could speak on the male side. Those taboos are slowly becoming less and less taboos. The conversation is obviously opening up. I also, but at the same time, at least here in Los Angeles, men are getting married at a later age, so fertility issues become a real thing. Second marriages, third marriages. So some of it's in the context of having children later in life as well. But the good thing is, the one good thing I'd say about it is, to your point, the conversations, people are much more willing to talk about these things. And that in itself, I think it's quite important, only because, or the main reason being that anybody who is experiencing infertility, they're not kicking the can down the road. They're willing to engage and see it like a reproductive urologist earlier on and address their issues earlier on, which makes things a lot easier for everyone going forward.
Yeah.
Yeah, I would agree. I think that we have come so far in terms of talking away the stigma and the taboo. And, you know, this is where I love the intersection of being a Jewish fertility doctor. Our matriarchs were all struggling with infertility. So this stigma that we've kind of like placed ourselves and made ourselves so lonely with, it's like it's almost like not even like a Jewish concept, but I think we're raised with this value of modesty in Judaism, and we want to be so private, and I get it. I'm just the organizations like Yesh Tikva and the support groups and the social media pages and the articles, I think they're helping so much in letting people understand, that there's no guilt or shame involved. It's really not your fault. It's a disease like anything else. And B, it's, I think, making people aware that they should be getting help sooner in the game, whereas they probably were suffering in silence and not really sure if it's normal or not normal. Now they know that help's out there. And there's this, like, for example, recurrent pregnancy loss is one that I find I'm always surprised that people are coming to me so late. Two miscarriages is all it takes for us to initiate a specific workup for recurrent pregnancy loss. And the more people find that out, the earlier they can come, and the earlier, hopefully, they can be on their path to parenthood, or at least a plan,
Yeah.
so
Yeah.
kudos to you for organizing this, and to Gila for running such a great organization.
Yeah, absolutely. And Gila, I want to end off with another question for you. I think the hardest one, which is, we want success. Every single person on this panel here wants success, but ultimately, sometimes treatment isn't successful, even though we are hitting it with everything that we have. How does the organization, Yesh Tikva, deal with the emotional impact of multiple cycles or unsuccessful treatment, because that can feel really hard. And again, like Dr. Wertheimer was saying and Dr. Human was saying, we're going to hit this with everything we have. Like, our success is your success, but we don't control everything, right? There's no such thing as 100% success rate for any treatment.
For sure, and a really hard question. I think that the way I would frame it is that there's this wonderful book that Dr. Ali Domar put out called Conquering Infertility. And towards the beginning of the book, she speaks about how important it is as you start out on your fertility journey. And just to frame, Dr. Domar is a mental health professional who specializes in reproductive health and created the Domar Center that brings together the cross-section of reproductive endocrinology, OBGYNs, and mental health. And she created a whole educational model around it. And so she frames that the most important piece that you need to discuss with yourself and your partner along this journey is, what is my ultimate goal? And as you define that and redefine that at every step of the way, you define how you process this journey. So as I had said earlier, if your ultimate goal is, I need to be genetically related and carry a pregnancy, then yes, you open doors from trying on your own to IUIs and IVF. But beyond IVF, there are no additional options. And if the ultimate goal is I am going to be called mom or dad, then all of a sudden we open doors to donor conception and adoption and gestational carriers. And so depending on what that looks like, depends on what your journey and how we support you through it. So are we supporting you through helping you close a door to open the next? Are we supporting you to help hold hope with you so that you can continue to pursue treatment cycle after treatment cycle if that's what your goal is? Or are we helping guide you to resources like Dr. Wertheimer and Dr. Human to understand what are my options? What does donor conception mean? Is that something that I can cope with? What would it look like for me if I was not genetically related to my child, but biologically related to my child? Or if I was genetically, but not biologically related to my child? Are those things that I can cope with in the long term? And so guiding individuals to the resources to help them process that and to hold them through it are the steps we would take along this journey, because there's so many options and so many levels that we can hold people through this. And one of them being choosing at the end of one's journey and saying, this is as far as I can go. What does it mean for me to now choose to end this chapter of my life and open the door to child-free, not by choice? And so guiding through those resources and continuing to hold them throughout their life. We have participants that have been with us for years, and though they have closed the door on growing their family, they're still with us, and we still hold them through care packages, support groups, peer mentorship. It's knowing that you're not alone in this is the ultimate piece of it. And the rest is really so personalized to each individual and the types of choices that they're choosing to make and that they need guidance through.
And I think if everyone takes one thing from tonight is that you are not alone in this journey, whether that's a journey by choice or that's a journey because of genetic issues or that's a journey because of infertility issues or combination. There are people in the wider community, both at Sinai Temple and the medical community, and the mental health support community, that are really here to support you. And I think that having that hope, and understanding that there is help, I think is so important. I am going to plug J Screen for a minute. We've talked about genetic testing a little bit and how important it is in the process. If you are interested in getting genetic testing done, we have a special code that we are using for tonight's event. If you go to our website, jscreen.org, you can order hereditary cancer testing or reproductive carrier screening, both important in a reproductive journey for anyone. And that code to put in with your orders to take some money off of it, make it a little more affordable, is Sinai Temple 2025. Again, that's Sinai Temple 2025. I want to thank everyone here who has come tonight and given their time to really show support for a really important issue that comes up a lot in our community. I'm going to take a few minutes to answer some questions from the audience, and then we will wrap up tonight. If someone is on this panel and they're like, oh my gosh, this should have been for my friend, we are recording this and it will be posted, so stay tuned for that. And I'm going to wait a few minutes for questions to come in. And I think my first question for both of our doctors, before anyone else asks a question, is, are you taking patients?
Go ahead, Sahar.
Now we're taking a break. No, I'm just kidding. We are we're taking patients. We love to see patients. I am at HRC Fertility in Beverly Hills. And you can find us on our website, Instagram, emailing Natalie or I guess Sinai Temple, and I'll pass it to Justin.
Yeah, and Dr. Wertheimer is fantastic when it comes to any of your REI needs. And the same thing, absolutely. We're taking patients. Um, my office is located on the Cedars-Sinai campus at Tower Urology. So absolutely anything we could do, let us know. Reach out.
And Kiva, same question. Can people still use Yesh? I know the answer, but I want everyone to hear it. Can people use Yesh services, and how do they find you?
Definitely. And we don't just support the 1 in 6, we also support their family and friends in understanding and learning how that they can best support their loved ones in struggle. And you can find us on our website, yeshtikva.org, Instagram, and also same thing about getting our email.
I have a very loaded question in the audience. I'm going to need everyone to answer this. What if someone's parent struggled with infertility? Does that mean that they're going to experience infertility? Is infertility genetic? I'm going to let both Sahar and Dr. Worth, I'm sorry guys tonight.
Don't worry.
It's Thursday. Dr. Human and Dr. Wertheimer answer this question, then I'm happy to answer it as a genetic counselor as well, but it is an interesting question.
I'll answer from the female perspective and I'll let Dr. Human answer from the male, that I'm curious to hear what he has to say. But from a female perspective, there are causes that can be genetic and then there are causes that cannot be genetic. So often I'll hear patients say, well, my mother had a baby when she was 42, so I didn't think I was going to have any trouble. And I hate to hear that because I think that's false reassurance. And while it's true that there may be better fertility in some families, I think often the genetic component is actually when the fertility is worse. So we know, for example, premature menopause can run in families. So if you see someone whose mother went through menopause early, we take that as a very strong prognostic indicator that their daughter might also, and take that very seriously in terms of fertility preservation. Certain things like PCOS may run in families. So it really depends on the cause is the answer. But I would just caution people not to take it in the false reassurance direction, and to just monitor their own menstrual cycles and symptoms. And if they're interested in fertility preservation, to always just come seek a consultation earlier rather than later.
Yeah.
And the question was, is male fertility genetic?
So if somebody's, a father had experienced infertility, does that mean that their child will experience infertility? Is it genetic?
Not so much, not so much, but well, I guess really what comes down to is the cause, right? The cause behind infertility. So, if it's like a genetic reason where the genetic reasons are generally like spontaneous mutations, and because they're spontaneous mutations and it leads to male factor infertility, especially the ones we know of, it really leads to severely, severely low sperm counts or essentially no sperm. So those aren't passed on. But the one genetic one that could be potentially passed on is a varicocele. Generally, varicoceles have it's not a very strong genetic component, but it's more of a physical attribute. So taller, lankier guys, they're more likely to have varicoceles. So if a son looks like his father in that sense, he may have an increased risk of a varicocele, which can cause some form of infertility, but it's a correctable form of infertility. So yeah, it's similar to Sahar's answer. It's on both sides of it.
I'm going to answer from just like a purely genetic standpoint. We definitely have conditions that we know of, like Klinefelter syndrome, or like we said, being a Fragile X premutation carrier. Those are just some of them that we know that are associated with
Absolutely, yeah, good call.
premature ovarian failure,
Mm.
low to absent sperm count for sure. That being passed on is a more complicated question. So I would say like definitely getting your family history, from parents and asking that is going to be important. Hey, like I know it took you and dad years to get pregnant with me, and I know you used a sperm donor. Can you tell me a little bit about that? I think is going to be helpful, right? If they're a donor, they're not related genetically to dad, but like helpful to say like, hey, mom, I know that like you only had one child and really wanted more children. Can you tell me a little bit about what happened there? Or Things like that I think are really important to help assessing for those kind of zebra genetic conditions. I will say in the world of genetics, we are not there and we don't know everything yet. And I'm sure we will learn much more about um, particular genes related to fertility. I mean, we already know, like Dr. Wertheimer was saying, something like PCOS, there's definitely a familial component to that. And we're continuously learning more. But I'm going to, underscore what the other providers have said. It really depends on what we're talking about. And that's why it's important to have that conversation with a provider. I have another question. Um, if I had genetic screening earlier in life, but didn't have a partner then, do I need to do something to make sure I update my screening? And then does it matter which partner goes first? Sahar, I would love for you to answer this.
You're the genetic counselor. You should answer this. Go for it. I have faith that you're going to say what I want to say.
So first and foremost, my colleague Abby always says this. Do you have an iPhone from 10 years ago that you're continuously using? No, you update your iPhone every year. You should be updating your carrier screening. If it has been over 3 years, you need to update your carrier screening, whether that's for reproductive purposes or cancer. You should definitely be doing that. We're learning more and more. And does it matter which partner goes first? In my opinion, no, but and I'm sure Dr. Wertheimer, you will agree with me, I would like, if you have a partner, for you guys to be screened concurrently. It just makes things a lot less messy. And, I would say in the terms of finding a donor, sometimes we run into tricky situations. I don't know if you've run into this, Dr. Wertheimer, where the donor was donated 10 years ago. And so their panel's a little older. Um, and they may not have been screened for everything that the patient was. And that is tricky because I don't know if you've had this, but I have a patient who fell in love with their donor. They're like, I want this donor. And I'm like, but that donor wasn't screened for that. So I think that's a really important conversation to be having with someone like Dr. Wertheimer when you're selecting your donor, making sure that you're comparing panels, because in some situations we can't always update this screening, which I think is important to talk about as well. But Dr. Wertheimer, I'd love any insight you have that I haven't provided.
No, I agree with you. I would just expand that the reason you're saying that is because more and more genetic mutations are being learned about. And so a panel from, let's say, 10 years ago has nowhere near the amount of genetic mutations that we're screening for now. Now we're screening for over 600 recessive mutations. And certain ethnicities we may know more about now. For example, Persian Jews, there's about, I think, 4 genes that are very prevalent in the Persian Jewish community. I'm not sure that those were on the earlier panels. And I also know that in the Jewish community, due to the stigma attached to genetic mutations, there was a panel that was being done kind of like blinded to the other partner and was only really testing for some core mutations because they didn't want to find more mutations because that would kind of dictate like the shidduch or the match that they were allowed to have. And I'm in this day and age when we can do IVF and PGT-M so easily to prevent passing on those genes, I'm so against that. We should try to have as many healthy babies as possible. And I think, as Gila always says, knowledge is power. And if you know what the mutations are, you can still say, I don't want to do PGT-M. I don't think this is bad enough. I'm okay taking my chances, but at least you made an informed decision.
Yeah, and I would totally underscore with, we all value patient autonomy. So you getting the information doesn't mean you necessarily change anything about how you're going to become pregnant, or the testing you're going to do, but at least you're coming into it with knowledge and understanding to help guide you. Because, Dr. Hume and I have talked about this before. You're dealt the cards you're dealt, right? It's just whether you want the knowledge about that. And maybe you'll do something different, maybe you won't, but most people do not like to be blinded with surprises later in life, and this kind of gives you that crystal ball, shall we say?
Yeah. We still don't know everything. There's still mutations we don't know about. And there's also de novo
Absolutely.
mutations, which is on the horizon to test for as well. But yeah, pretty cool.
Absolutely. I think those are all our questions for tonight. Again, I want to thank everybody here for the incredible job. We're just at about time that they've done tonight. All of these individuals, myself included, are on social media. So if you're, like a little, you want to get to know them a little bit, go ahead and go follow them. They're incredible. They put out incredible educational content. You should check that. Dr. Wertheimer has a personal account, as does Dr. Human, where they talk about this all the time in such an accessible way. If you're interested in getting that testing, again, a plug to go to jscreen.org, or you can check us out on social media. We do talks like this all the time at Get JScreened. And I'm wishing everyone a beautiful Shabbat, and hopefully just coming out of this feeling empowered to really live their life and support those in their lives who need that. Oh, I have one more question I missed. I think this is going to be for everyone, but what are recommendations for couples just starting their fertility journey?
Just starting your fertility journey, meaning you're trying to conceive and you haven't had any issues yet, I would say pay attention to your menstrual cycle, pay attention to your ovulation day. You can use ovulation predictor kits off of Amazon and try and time intercourse to ensure you're getting the right timing, because that's so important. If there is pain with your menstrual cycles or pain with intercourse or random spotting in the middle of the month, don't be afraid to ask if that's normal. Chances are it's probably not, and there might be something that we can evaluate. And that's my, and get your genetic testing done and optimize your health. Like Dr. Human was saying, anything that's, I think you said, anything that's good for your heart is good for your fertility. I always think of preconception as being a really good time to tap in and make sure that your high blood pressure is controlled, your diabetes is controlled, anything else that you may be dealing with, like, don't lose sight of the big picture. We want healthy mom, healthy baby.
Yeah, absolutely.
And educate yourself.
And Dr. Human, any closing thoughts on that?
Yeah, I would say, the earlier you get tested, the better. If a guy at any point you feel like it's been 3, 6 months, just do a semen analysis. It's relatively easy. You could do them at home these days. You could order at home test kits for that. Be patient. People tell you about their wins. They never really tell you about their losses. And there's a lot of people who struggle with this. So if you feel like you're alone, you're not the only one. I think all of us could attest to that. That there's a big population of people who unfortunately are struggling with this. So you're not alone in that process. There's a lot of resources out there for you. But good thing is there's a lot of good resources out there to help you throughout the whole fertility journey, and hopefully make everyone a happy mother and father.
Amazing. Thank you all for your time tonight. And
Thank
we will be hopefully posting this recording. So if you know someone who would enjoy this or would learn from this, please feel free to pass it on. Wishing everyone a very, very beautiful rest of your evening. And thank you for joining us today.
you.
Everyone.
Thank you.
Thank
Natalie.
you.